So it's day 18 of Alan's keynote study streak, and today we'll study two very important remedies which are connected to the damp weather that we are experiencing in Mumbai and maybe very soon in other places we will be experiencing. So the first remedy that we'll discuss, and it is in continuation or kind of very similar to the remedy that we discussed yesterday. Yesterday we discussed about phosphorus, arsenic, phosphorus, and allium sulfur. So today we'll continue and read about causticum. Now, when we read the first line about causticum, so let's go over Alan's keynotes. Those who are joining new, you can just open Alan's keynotes and go through whatever is written in Alan's keynotes, and I'll add my few views and give you tips on how you can see it in your clinical practice, potency, prescription, reputation, etc., wherever needed. Ailments from long-lasting grief and sorrow, like the remedy phosphoric acid. Ailments from loss of sleep. Ailments from night watching, like remedies cocculus ignatia. Ailments from sudden emotions, ailments from fear, ailments from fright, ailments from joy, like the remedy coffea and gelsemium, good emotions. Ailments from anger or vexation, ailments from suppressed eruptions. So you have a long list of ailments from in the remedy causticum, and if you see the very first line, there is a mention of ailments from long lasting grief and sorrow. Now it is so much important to remember every word in whatever is written in Materia Medica, especially in Alan's keynotes, because when you open the repertory and when you see the remedies that are present for people who cannot overcome grief after months of the incident that has happened, after many years of some bad incident that has happened, the only two remedies you will see mentioned is causticum and phosphoric acid. So if you come from the way of repertory, you will see only few remedies. Mainly causticum will be strongly present, phosphoric acid will be present. But if you remember from the Materia Medica, it will strike even more better and it will give you more confidence of prescribing, because when you read something in the repertory, you will again go back to the Materia Medica and confirm it, unless it's a very strong source which you know. Otherwise, you should confirm the remedies what are mentioned in the repertory. You have to confirm them in the Materia Medica. But if you know the Materia Medica well, it's going to be a very easy journey. So that is the first pedestal of your success, that you need to remember word to word, line to line, whatever is mentioned in Alan's keynotes. Causticum is adapted to persons with dark hair, rigid fiber, weakly psoric with excessively yellow or sallow complexion, a kind of a wheatish you can say, and those who are subjected to respiratory and urinary tract infections. Children with dark hair, eyes delicate and sensitive. They have melancholy mood, sad, hopeless from care, grief, sorrow, with weeping. The least thing makes the child cry. We saw this very strongly in it's there in Pulsatilla, we know about it. It's there in you know Medorinum also. It's there in few children related remedies. But here it's also added, and you have to note it in your mind, and you see the components, the other components of the case. A child with a urinary tract infection who is presenting with complaints of uh, inability to clear the urinary tract, etc., that should make you think of causticum. Or someone who has a cough which is not able to bring out. So you see that not able to finish that something, some act will more or less make you think of causticum because it is related to local paresis. We'll read about it very soon. So that component should be added with the least thing makes the child cry, what is mentioned in Allen's keynotes for causticum. Then we have intense sympathy for the suffering of others. Now, why it is mentioned that it is very much close to phosphorus is because it has this feeling of being good and doing good for others around him. And causticum and phosphorus both have the same feelings. They are very much close and they will have sympathy for suffering of everyone around them. Next we have rawness or soreness of the scalp, throat, respiratory tract, rectum, anus, urethra, vagina, uterus. Wherever there is rawness or soreness, now how is a patient going to explain you that there is rawness and soreness? There will be a kind of a feeling that there is not being able to feel strong in that part, or there is a feeling as if it is beaten, okay, or it is a kind of feeling where it is uh, rawness means that it's kind of a scraped something, the area is scraped of the upper layer of the mucous membrane, and that has invited a kind of a vague sensation which is bordering between burning and bruised soreness, okay. Now if it is exactly the patient words that as if it is beaten or as if it is someone has hit me or I feel as if I am hurt, then it goes to arnica. If it is sprained, it goes to rustox. Next line what we have in causticum from the Allen's keynotes is children who are slow in learning to walk. The other remedy is calcarea fos. We also saw this mentioned in which remedy? Can anyone tell? We are doing this since the past 18 days. It's 18th day of our Allen's keynote study streak. And if you find the last 18 days lectures, you find this remedy which has mention of children who are slow in learning to walk, children who are slow in learning to walk or talk. You will find any of them in the last 18 days. Drop me on the name of the medicine. The other remedy over here is mentioned as calcarea fos, and we are reading causticum. Yeah, so I think Dr. Purvi is very much attentive and we have the answer, calcarea carb. There is one more remedy which has children who are slow in learning to talk. This is also there in one of the remedies. Slow in learning to walk, calcarea carb we can definitely think. There is another spectrum which is slow in learning to talk, and you have to find out that also. So unsteady walking and easy falling of little children. This, if you see the meaning of these lines, you see it is very clearly related to the strength of the local parts and inability to get that strength which is needed in those parts, and the entire body being developing at a good pace. So we have this kind of a unsteady walking and easy falling of little children. At night, unable to get an easy position or lie still a moment. So they'll keep on changing positions. You have children, you have people who keep on changing position in sleep. They are restless. Causticum is one of the remedies. Causticum has many night modalities. If you go and read it in the repertory, one of the modalities which I always confirm from patients when they have chronic coughs, in Kent repertory you will see the only remedy lying aggravates only on line, the remedy is causticum. So I've given it to innumerable patients, and the other component being that they are not able to bring out the cough. It is mostly located in the throat, and they don't have the power to bring it out. So we have over here something which is aggravated at night, unable to get an easy position or lie still a moment. The other two remedies are eupatorium and brush talks. Must move constantly, but motion does not relieve. If it is the opposite, you see the remedy which is brush talks. Cannot cover too warmly, but warmth does not ameliorate. Faint like sinking of strength, weakness and trembling. Next we have a symptom which is often overlooked and never understood by homeopaths, and if you understand this symptom, it's going to unlock a lot of your cases. The symptom goes something like this, where the remedy is useful in cases where patients improve for a time and then they come to a standstill. So many cases that we have where patients come and tell us that I am feeling better, but I am not completely better. In those cases we can think of causticum, but there is a but always, and you have to respect the but, because that goes along in many places, because you need to understand the constitution, you need to understand the background of the patient, the sphere of action of the patient. If it is mostly in the skin, think of sorinum sulfur. If it is mostly in the respiratory and urinary tracts, think about causticum. Nervous system, think about causticum. So if those are the predispositions of the patient, think about the remedies causticum, sorinum sulfur accordingly, and not just any remedy XYZ because it's mentioned in the books. There is a reason for everything that is mentioned, and you need to go in the background and see what the reason is and then prescribe. Causticum affects the right side prominently. Skin is prone to intertrigo during dentition, like the Lyco remedy, or convulsions with eruption of teeth, like the remedy Stannum metallicum. Drooping of the upper eyelids cannot keep them open. So you see again there is a local paralysis. Colophyllum is another remedy, gelsemium, and if it is and also graphitis is there for drooping of the upper eyelids, cannot keep them open. If it is both the eyelids, then the remedy is sepia. If it is one eyelid, only the upper side, the remedy is causticum and the other ones. You have cough with rawness and soreness in the chest with inability to expectorate. Sputa must be swallowed. So if you go in many of the rubrics in Kent repertory, in Boric repertory, and many other repertories of course, but in those basic repertories if you go, you will see that there is kind of a symptom which gives you the inefficiency of that local part of the remedy causticum to bring out the discharge. And if it happens in the respiratory tract or the urinary tract, think about causticum very strongly. Other remedies being arnica and gallica. The very much contradictory modality, and you can try to confirm from patient if they feel better by drinking cold water, but it does not necessarily mean that if it is not there he will not give causticum. It is just one of the additions. Not many patients will take cold water if they have cough, so you have to understand that. Also there will be cough on expiration. So there is a very beautiful thing when you examine patients. You just don't take the cough symptoms on face value. Okay, face value means that you don't take the symptoms as it is told by the patient, but you wait for them to cough, number one. Number two, you examine them, and number three, you try to correlate what the patient has told matches with what you have examined. Otherwise you go back and take the case again. You try to lay your foot on something which is strong. It can be a strong modality, it can be a type of cough, it can be some causation. Okay, so there needs to be something strong on which you are laying your foot. Otherwise, you are just making a sketchy case taking, sketchy prescription, and your cases will fail. So, cough on expiration, this is what we were reading, and many times there have been patients who have coughed on examination, on inspiration or expiration. Think about remedy causticum, think about aconite if it is on expiration. If it happens also with pain in the hips and with expectoration chiefly at night, and if the cough remains after a bout of whooping cough which has gone. So those who are new to this Allen's keynote study streak and they have not gone through one of the tips that I had given during the cough epidemic which was going on few months ago, I think in winters, you have to go back and watch that reel where I spoke about how will you differentiate three the three stages of cough. Okay, so go to the profile and watch the reel which says about how will you differentiate cough and how will you find it in the repertory, how will you find it in materia medica. So over here causticum is a remedy which is given in patients who have cough after the entire bout of pertussis or whooping cough has passed on. So there is a remnant, you have to understand that there is a remnant, and this remnant is that they are unable to clear that last phase of the cough which is disturbing them somehow, and this is what we need to give causticum for. Hoarseness with rawness and aphonia aggravated in the morning. If it is aggravated in the evening, carbovage and phosphorus are the remedies. Constipation, frequent ineffectual desire, very 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 strongly we know the remedy causticum and naxomica should be thought of. Now interestingly over here the stool is better when person is passing the stools when he is standing. It is impeded by hemorrhoids, tough and shining like grease in children with nocturnal enuresis. So children who have there are different components. When you read the components, you read them together, but when you take a case, it will be scattered in different parts. So you'll have a patient who is landed in your clinic and he has nocturnal enuresis. The parents are giving you the entire history, and then they tell you that the child is very kind natured, good natured, and he feels for everyone. He talks about everyone. He does things for everyone. Whenever anyone in the home is ill, they will feel the suffering of others, etc., etc. And still, the remedy doesn't strike you, or it strikes you partially. And then somewhere in the physical journals, you will find that there is constipation also. If you are a good student of materia medica, you will be able to find out that constipation in children with nocturnal enuresis is mentioned in Allen's keynotes, and that is where you should pick up this and give it right away. Okay, so it's a remedy which, in fact, in materia medica you will have symptoms mentioned together, but in the patient you will see it scattered in different components and you need to bring it together, and that is why we have the repertory for. But if you are a good student of materia medica, you won't even need a repertory. So then further we have urine which is involuntary when coughing, sneezing, blowing the nose like the remedy pulsatilla, squilla, veratrum. And then we have female reproductive system where the menses is early to feeble only during the day, cease when lying down. We saw a symptom similar to this in another remedy which was only during the day. So any one of you can find out and drop in the comments when the video is posted. Rheumatic affections with contraction of the flexors and stiffness of the joints, tension and shortening of the muscles, ammonium mur, Cimex, guaiacum and natramur are the other remedies. So you know what happens when you read these symptoms? You should know in what clinical conditions there is shortening of muscles. For example, the cases of cerebral palsy. For example, cases of muscular dystrophy. These cases will require remedies like causticum, guaiacum, natramur, ammonium mure, Simex. Go to all the authors who are prescribing medicines for cerebral palsy. You will see any of these remedies coming in those prescriptions. And you don't need to be a, you know, don't need to invest in so many things to develop these abilities to understand. These are just the basic books that you need to read and get access. Disrupt functional activities of the brain and spinal cord from exhausting diseases or severe mental shock resulting in paralysis. Paralysis of single parts, local organs, tongue, eyelids, face, extremities, bladder, generally of the right side, from exposure to cold wind or draft after typhoid, typhus or diphtheria, gradually appearing paralysis. So any case which has the features that the local part or the local area is not working, there is a kind of a stagnancy in the case, and the patient is not improving, the local part is not responding to any medicine, and everything that has been needed is tried, you should give causticum in those cases. Cicatrices, especially burns, scars, freshen up, become sore again, old injuries reopen. Patients say they have never been well since that burn. So we saw never well since typhoid, never well since any infectious disease, and now we see never well since that burn. Never well since any infectious disease, the remedy is different. We studied it in the last 18 days. If you don't remember, go back again to all the 18 days remedies and read it. Not well since typhoid, the remedy we discussed, I believe, just a few days ago. So it should strike your mind when those symptoms are told by patient, those remedies should strike your mind. And when will it strike your mind? When your materia medica is strong, when your Allen's, keynotes, Bodic, your Clark, your Dubé, whatever materia medica you read is through and through. Yes, so there is someone named as Anwar 19731 Carbovage. Yes, you're right. But it's a well-known fact, and I don't know whether you have attended the previous sessions or whether you are quoting from your knowledge, but whatever comes is well and good. So let's go further and read about causticum, the last lines about the skin. So you are also sharing about selenium for never well since typhoid. That's a good addition. We have not seen that remedy yet. So when we see if it is there in Ellen's, I am not sure if it is there, but we'll definitely go through it. Thanks for the addition. So causticum has warts which are large, jagged, often pedunculated, bleeding easily, exuding moisture, small all over the body, on eyelids, face, and on the nose. Aggravation in clear, fine weather, but they are better in damp weather. So you have patients who have the opposite modality, and they feel better in warm air. They have aggravation from coming into the air from the warm room, like bryonia, and aggravation from cold air, aggravation from draft of cold air, and on becoming cold from getting wet or bathing. In relationships, you see the remedy Carbovage as complementary, petroselenium is complementary. It must not be used with phosphorus before or after phosphorus because they both are incompatible. They both have kind of a similar way of working in the body, and that is why it is always quoted. And it always disagrees acids and the coffea. You have to compare Carbovage also with arnica. You also have to compare causticum with arnica. Must swallow mucus. Similar presentation we see in causticum also. And the remedies gelsemium, graphitis, sepia in ptosis, the falling of the eyelids. And you have to compare causticum with rumex and carboveg also when there is aggravation from changes of weather, especially aggravation in the evening. And if there is chronic aphonia, you should think of sulfur along with causticum. So causticum antidotes paralysis from lead poisoning, bad effects from holding type of bad effects of holding type in mouth of compositors, and abuse of mercury or sulfur in scabies. So we come to an end with causticum, and we'll study the next remedy, which is more or less related to the paralysis component of causticum, and the remedy is gelsemium. So let's open from Allen's keynotes. Gelsemium, bad effects from fright, fear, exciting news, or sudden emotions. Now this is such a beautiful line that you don't get to know from the patient whether exciting news or sudden emotions have been a positive factor, but we'll have to find it out from the complaints that the patient share, and then go back and ask them what did when did the complaint origin, what made you feel like that when in the first instance. For example, there was a case I saw, and this girl had been taken from her parents' place to her relative's place, and she had not stayed at the relative's place for a long time away from her home. So the next day she developed fever. The parents were informed by the relatives, and they went and brought the girl back. The girl developed fever. They brought her to me, and I was just understanding her case. She told me there is fever since yesterday and this and that, and there were other complaints. And anyone would think of the fever remedies, aconite, belladonna, arsenic, pulsatilla. But I just happened to ask her, what made you feel that fever started, or what was your emotion? She was a grown-up girl, like around 7 to 8 year old, and she told me that my relatives took me from my parents, and I felt really bad. I was never away from my home, and I was missing them so much that at night I kept on thinking I would have slept with my dad, I would have slept with my mom around me, my sister around me. And the next day she developed fever, and that is when they brought home. So you have this sudden emotions which arouse the feelings of fever or any other complaints. Think of gelsemium. Going further, we have for children, young people, especially women of a nervous hysterical temperament, the remedies also which we should think are crocus and ignatia. Excitable, irritable, sensitive for the nervous affections of onanists of both the sexes, the other remedy being califos. Fear of death, like the remedy arsenic. Utter lack of courage. Anticipation of any unusual ordeal, preparing for church, theatre, or to meet an engagement, brings on diarrhea, stage fright, nervous dread of appearing in public, urgent nitricum. I don't know how many homeopaths have taken this before their vivas, how many medicos, how many students have taken this before their oral examinations or even written examinations. But this remedy and urgent nitricum can be called the sheet anchors for such anticipation before examinations. Desire to be quiet, to be let alone, does not wish to speak or have anyone near her, even if the person be a silent, like the remedy ignatia. Children fear of falling, grab the crib or seize the nurse. The other remedies are borax and sanicula. General depression from the heat of sun or summer. Now it's a summer remedy, and you have aggravation from damp weather in gelsemium, whereas it was the opposite in causticum. There is weakness and trembling of the tongue, hands, legs, and of the entire body. chill without thirst, especially along the spine, running up and down the back in rapid wave-like succession from sacrum to the occiput. So there is a chilliness which originates or starts in the back, and this can be confirmed many times from patients. Where do you feel the chilliness more? Where is the origin of chilliness? They will probably share a few hints for you to think about the remedy. Lack of muscular coordination, confused muscles refuse to obey the will. So there are patients who want to do something but they can't do because of weakness, because of, it's a kind of paralytic state, of course. Think about gelsemium in those cases. Vertigo spreading from the occiput, like the remedy silica, with diplopia, dim vision, loss of sight, seems intoxicated when trying to move. So as soon as they move, they feel as if they have giddy feeling, vertigo feeling. Headache, which is preceded by blindness, remedy, another remedy being Kali bicomicum, better by profuse urination. We saw this also in silica. In fact, it's also there in sanguinarium. Headache, which begins in the cervical spine. So everything now, wherever you see, everything that is connected to the spine, occiput and back of the neck has the remedies gelsemium indicated for you in your clinic. So headache also, which starts from the cervical spine, pain extend over the head, causing a bursting sensation in the forehead and eyeballs. And sanguinaria and silica also begin in the same way, but they are having semilateral, one of the sides. Sanguinaria more right, silica more left. And aggravated by mental exertion from smoking, heat of the sun and lying with the head low aggravates. Sensation of band around the head above the eyes, like carbolic acid and sulfur. Scalp is sore to touch. Very few patients give this sensation of band, otherwise it's just for remembering for the examinations. But what you will see practically is the next symptom, which is mentioned in Allen's keynotes for gelsemium, which is great heaviness of the eyelids, cannot keep them open. This you will see very often in practice. Other remedies being causticum, graphitis, sepia. Fears that unless on the move, heart will cease beating. Fears if she would move, the heart would cease beating is digitalis. But here he feels that he should move, otherwise the heart will be stop moving. Slow pulse of the aged. So many times you will be able to catch the patient's acute state by the pulse. Belladonna, bryonia will have something that is quick, fast, rapid. Gelsemium will have a slow, gradual pulse. You will be able to feel it. And there are other remedies which will give you different pulsations, but that's not the arena which we should step into right now. So going further, we have gelsemium, which is having complete relaxation of entire muscular system with motor paralysis. So, something that is belonging to the spine, occiput, originates from the occiput towards the front of the body, should make you think of gelsemium, and especially cases where there is motor paralysis. Aggravation from damp weather, before a thunderstorm, mental excitement or emotions, bad news, tobacco smoking when thinking of his ailment. We saw this also in another remedy. You can drop by the names in the comments or once the video is posted. Aggravated when thinking about his complaints. Don't tell me oxalic acid, okay? It's remembered for viva, for examinations, written examinations, but there is another remedy which we have discussed in the last 18 days. So go over it and tell me. So when thinking of his ailments aggravates, and when spoken to of his loss aggravates. Someone telling him that something bad happened, you will have this state which is developing their emotions and causing them problems. So there is someone answering yes. Priyanka Madan on YouTube, Medorinum, and Dr. Anwer on Instagram. You have answered Calcarea Fos. Okay, right, maybe accurately true. But Calcarea Fos is mentioned everywhere in the brackets. The main remedy that we discussed was Medorinum, which is correctly shared by Dr. Priyanka. So if you are well versed with materia medica, and Dr. Shirley is sharing about oxalic acid, no doubt about it. If you are well versed with materia medica, and these things are very subtle things which you will have to ask from the patient. No, none of the patient is going to come and tell that when I am thinking about the complaints it causes me problem. But you can corroborate from the patient when you have taken the case, when you feel that there is something deficient in the case and you need to ask something more. Gelsemium is the remedy which we are discussing. We come to an end, and there is a comparison with baptisia in threatening typhoid fever and in ipecac in cases where there is dumb egg or suppression by quinine. So that brings us to the end of two remedies today, causticum and gelsemium, almost similar, having opposite modalities, and both have peculiar symptoms acting on the nervous system. Causticum acting more on the respiratory, urinary, and the nervous system, whereas gelsemium acting predominantly on the emotions and the motor system of the body. So I hope the learning is going good, and go through all the 18 days sessions which have been posted on the timeline. I'll be removing them soon because it was less time that we will just do a live and leave it off, but we kept it for a few days. So there are many tips and tricks that you will have if you hear them, and there is something for everyone who wants to tune into. And let's connect tomorrow again with another set of remedies. And if you wish to join the WhatsApp community, please drop your name in the comments of the video, and we will take it further from here. So till then, good day and happy learning to everyone.